50 to 60% of the ticks are infected.
We're having a big difficulty getting these people diagnosed.
The immune system is designed to kill and attack.
Do you see Herx reactions?
People do typically get better, and they may get 60 to 80% response even in the first month of treatment.
And what pressure do you use?
And so oxygen, what does it do? It's healing.
That's the cherry on the cake. Hello, and welcome back to Hyperbaric Living Podcast. I'm your host, Dr. Masha. Today, I have with me Dr. Korey DiRoma. He's a naturopathic doctor. He works at Stram Center in Albany, New York. And for the past 20 years, Stram Center has been providing conventional and natural health treatments using herbal and nutritional therapies, IV therapies. And just recently, although I think it's been more than 2 years, they've introduced hyperbaric oxygen therapy. Dr. DiRoma has been with Stram Center for 15 years. As I said, he's a naturopathic doctor, and he specializes in treating tick-borne diseases, which we know as Lyme disease, cancer, and autoimmune diseases using natural therapies. Welcome to the show, Dr. DiRoma.
Thank you. Thank you for having me.
Yes, it's great. And today we'll talk about hyperbaric oxygen therapy and tick-borne diseases, or Lyme disease, better known as Lyme disease, although it could be caused by other infectious agents, right? Could
Correct.
you, well, let's start from the beginning. First, you were treating Lyme patients, and then you started using hyperbaric oxygen therapies, right?
What we were finding is with our therapies, we were utilizing IV therapies, IV antibiotic therapies, in combination with other natural therapies to really try to help stimulate a healing process while also treating the infection. And what we were finding is that oftentimes, especially with the chronic infections, we were, after treatment, some patients were actually having some of their symptoms coming back, and we would have to retreat. Once we started incorporating hyperbaric oxygen therapy, what we were finding is that the response to treatment actually became quicker, and people were actually getting patients were seeing a better sort of resolution of symptoms, and the symptoms were oftentimes not coming back after treatment. And what we're finding with the hyperbaric therapy is that the oxygen is providing some antimicrobial activity, and it's also helping the penetration of the antibiotics get into cellular tissue at a much deeper level. So we're getting a better penetration of treatment.
And I definitely want to come back to that, because that's the
Mhm.
interesting part.
Yes,
That's the cherry on the cake, really. But let's start from the beginning. Lyme disease is widespread, especially northern states of US, Canada, all Northern Europe, England, or England, Scotland, all these countries are affected. We're seeing more and more cases diagnosed each year. And I've always wondered, is it because our immune systems are not functioning as well as they did even 50 years ago? And that's why we're seeing more and more cases of Lyme, they're becoming chronic and stuff. Or is it because we have better diagnostic tools to diagnose Lyme disease? What's the reason, or what is the case here? Why such an endemic pandemic, Lyme pandemic?
I think it actually could be a little bit of both. I don't know if our immune systems are changing per se, but I know certainly in the Northeast here, the tick population is higher. We see the ticks infected with the Borrelia bacteria, which is the spirochetal that causes Lyme disease. We see that the ticks are 50 to 60% of the ticks are infected. And so with higher tick populations, and with these ticks being sort of infected with these bacteria at higher numbers, we are seeing that the exposure is there, right? And then I think that there's also identification of this as well. Now we know that there's Borrelia burgdorferi, which is a causative agent of Lyme disease, certainly in the Northeast. But now, there are many different strains of Borrelia in Europe. There's Borrelia absceali and greenii. In Japan, there's Borrelia miyamotoi, which is actually in the tick-borne relapsing fever group. We have a Midwestern strain, we have a California strain. So there are many different iterations of this Borrelia bacteria that we're actually now starting to find and identify. And because of where the tick population typically is in the Northern Hemisphere, and at the same climate zone, actually in the Southern Hemisphere. We'll see it in Australia and certain areas there as well. And probably climate change is a contributor as well, as tick migrations actually move, and they're moving further up north, actually into Canada. We see higher instances in Quebec and Montreal as well.
There are also theories that there are mother to fetus transmission. I think that might account for it too. As far as I know, it hasn't been proved, but it's always there,
For Lyme disease,
yeah.
Yes, there is actually, a mother who is undergoing an active infection can certainly pass to their child.
Yeah.
In Europe.
Yeah, I see cases in Spain per Spanish health web page. There's no Lyme disease in Spain because ticks that transmit Lyme disease don't exist in Spain, but I'm seeing a lot of cases, and usually from expats, either from United States or from Northern Europe, from England. Tons. And in countries like Spain and Australia, where presumably there's no Lyme, and we're having a big difficulty getting these people diagnosed, because and this is my next question, diagnosis could be a problem. Is that correct? Do you see that as well, that people can have symptoms, but then their test results will come back clear?
Yes, and one of the major issues with that is the testing itself. It is an antibody test, which really is an indirect test. So it just tests your immune system's response. So it's really looking for exposure. It's never really looking for the actual bacteria itself. And what we find is that with the first, certainly in this country, we use a two-tiered method. And so there's a screening Lyme antibody test, which is known as an ELISA test, just to see if you have any antibodies being produced. And if that comes back positive, then it reflexes to what's called a confirmatory test, which is the Western blot. And the Western blot shows an array of antibodies to the Lyme bacteria. And that is actually typically a more sensitive test. Now, the first test as a screen test is research has shown that it may only be about 50% sensitive. So you could be missing half of the cases, right? So basically we could be getting false negatives. And so we never actually, in those patients, they're deemed not to have Lyme disease, and they never actually get to a Western blot. What we do at our center is we actually utilize multiple Western blots from different labs to really see if there are antibodies that are showing up that are specific to the Lyme bacteria. And that really tells us that there's been exposure, right? And if they have symptoms, then that gives us the clinical diagnosis of a Lyme infection.
Lyme is quite difficult to diagnose, and this is for my listeners. It's called great imitator because it imitates 100 other things, from chronic fatigue syndrome to heavy metal toxicity to whatnot. It takes a skilled practitioner to even suspect that a patient could be having Lyme and save that patient time and money, because it's quite frustrating going from one doctor to another, trying to get the diagnosis. And I'm really glad to hear that you're utilizing several Western blot tests, to actually make this journey a lot easier, at least getting the diagnosis. With Lyme, also, we need to mention that there are co-infections that need to be tested for. So other bacteria that usually or a lot of times or in some cases are present as well. They
Correct.
produce sort of different symptoms, so to say. And when you're seeing Lyme
Hmm.
patients day in, day out, you learn from your clinical experience to distinguish, okay, this is probably Babesia, or this is Rickettsia, or this could be that. So yes, better to go to someone who specializes in treating this kind of patients if you suspect that you might be having Lyme disease. And once the person
Hmm.
gets diagnosed, what is your typical protocol? Where do you take it from there?
So again, we are fairly complete in how we do our testing. So we will not only run diagnostic tests for Lyme and Western blots, as you mentioned, we will do testing for babesiosis, which is a tick-borne parasitic infection that can cause headaches, fevers, shortness of breath, anemia, and sweats, especially drenching night sweats. We will check for anaplasmosis or lichiosis and Rocky Mountain spotted fever, which are the rickettsial bacterial infections, which tend to cause high fever and extreme headaches, also joint pain and fatigue. We will also check for Bartonella, which is commonly known as cat scratch fever. Bartonella is an interesting bacterial infection because it can be passed by ticks, but also other hard-shelled biting insects we call ectoparasites. That's lice, fleas, sandflies, chiggers, and that can also lead to some of these chronic symptoms as well. Typically with Bartonella, we might see more vascular issues or rashes. The stretch marks, right, sort of is one of the classic signs of of Bartonella. But our treatments then will be determined based on what we find through testing. Because oftentimes when you get a tick bite, you could potentially get a Lyme infection, but what if, you're also having symptoms of babesiosis as well. So the treatment might look like antibiotics or antibacterial treatments for the Lyme infection, but anti-parasitic therapies for the parasitic infection. And so that is something that we might actually combine at the same time, right? And so that is part of sometimes figuring out which agent is causing which symptoms, because if you go on antibiotics and you're still having either sweats or headaches, we might think, oh, okay, maybe there's also a Babesia infection and address that as well, right? But predominantly for our treatments, we will use conventional therapies. These are infections, so oftentimes we'll use anti-infectives. And then what I like to do is also look to support the body through fighting the infection, right? So it's always about helping to stimulate the immune response, looking for any nutritional deficiencies that somebody might have, because basically these infections really will sort of rob your body of nutrients, right? Really deplete them. So we'll see lower B12 levels, we'll see lower iron levels, we'll see lower vitamin D levels. These are all things that, will definitely contribute to fatigue, neurological symptoms, brain fog, cognitive dysfunction. So these are all things that we'll look to address at the same time of treatment, right? And then of course with antibiotic therapy, we'll use probiotics as well to sort of help support the gut microbiome through the treatment.
So to summarize that, you would give conventional treatment, which is antibiotic treatment, but you would also add other therapies that would sort of help the terrain, because it's always about the terrain. I mean, yes, it is about the infectious
Mm-hmm.
agent, but we all experience illnesses differently. Why? Because terrain is different. Why three people in the same
Mm-hmm.
room having a conversation with somebody who has influenza, but only one will get sick.
Hmm.
It's the terrain, same with Lyme disease, and it's important to get that supportive treatment because the body needs to have resources to fight the infection. And
Correct.
are
Yeah.
you using any other therapies except for hyperbarics? I will get to hyperbarics because this is what the
Hmm.
show is about. I will
Right.
definitely get there. But I wanted to hear more, like, do you use IV therapies as well? Like maybe ozone therapy? What else do you use in the clinic?
Right. So what we do is we'll typically, so we'll start oftentimes with oral therapies and see what the response is there. Because oftentimes, our combination of uh, medications and support, right? Uh, People do typically get better, and they may get a 60 to 80% response even in the first month of treatment, especially for those who really have not been treated for this before, right? For those who have tried treatments in the past, who have failed potentially other treatments, who still have symptoms, we might go with actual um, more aggressive treatments, right? So we may actually combine IV therapies, IV antibiotic therapies, high dose vitamin C therapy, which high dose IV vitamin C uh, acts as a pro-oxidant. So we'll use it for viral infections. We'll also use it for bacterial infections as well, because high dose IV vitamin C can actually work well as an anti-infective. We'll combine that then with hyperbaric oxygen therapy as well, because both therapies are pro-oxidant therapies. They tend to increase actually oxidative stress, which we can talk about when we talk about some of the mechanisms of hyperbaric oxygen therapy. But increasing oxidative stress, which actually does kill things like bacteria and microorganisms that typically do not, they're anaerobic, so they typically do not have mechanisms to fight oxidative stress and even cancer, right? So it sort of works on a similar mechanism. So we'll combine those therapies, typically IV antibiotic therapies, IV vitamin C. We utilize IV NAD plus. NAD plus is a nicotinamide B2 derivative that actually helps to increase cellular energy, right? And so we'll use that as well, and we'll also utilize other vitamin and nutrient therapies, glutathione as a major detoxicant as well. So typically we'll have our patients getting glutathione pushes every day, actually, with their treatments.
So let's say a patient qualifies for hyperbaric oxygen therapy, a Lyme patient. Let's say they
Hmm.
failed some treatments in the past or treatments were not administered properly, because that can happen too. And I think that's the biggest problem with patients who are diagnosed with acute Lyme disease. They're just getting antibiotics for 2 weeks, but they're not followed through properly, and they might relapse and they might still develop chronic Lyme. So let's say you get this patient and they qualify for hyperbaric oxygen treatment. How do you administer that? Like, do you start from the beginning of the treatment, or it's something that comes into the picture, I don't know, in the second month of the treatment? And are there specific maybe pressures that you see from your clinical experience that work better? I'd love to hear all of that, because there are a lot of Lyme patients out there listening to this podcast. And usually when I look at the statistics, episodes about Lyme disease, it tend to do really well. So it's obviously a problem, and everybody's looking for solutions. So I would like to hear your opinion. How do you do it, and your approach, and the results, of course.
Sure. Oftentimes, so we can utilize hyperbaric oxygen therapy with both oral antibiotic therapy and IV antibiotic therapy, and oftentimes we will do it at the same time. And when patients come to our center, you mentioned Northern Europe. We've actually had, especially pre-COVID times, quite a number of international patients coming from Ireland and the UK. to our center for treatment, and they would get 5 days a week IV therapies and hyperbaric oxygen therapy at the same time. And certainly for people who are local to this area, they oftentimes will do that for about 4 weeks.
I'm sorry to interrupt you, but when you say at the same time, you don't mean that they're getting IV inside the hyperbaric chamber, right? They get an IV and then they get into hyperbaric chamber, or the other way around.
That is correct. Right.
Yes.
Yeah.
Just to clarify.
Mhm.
Okay.
Yes. Yes.
So
Correct.
you combine that, and how many sessions typically do you find is sufficient or is effective for somebody who has Lyme?
So our therapies typically are in 4-week increments, and then we'll reassess at the end of 4 weeks, and that gives us, you know, 5 days a week. So it gives us 20 days really of treatment, and so we'll do 20 hyperbaric oxygen treatments during that time. So 5 days a week for 4 weeks, and that'll also be with the antibiotics and the IV therapy support as well.
And what pressure do you use? Like, where do you start?
So we'll start at 1.3, and so 1 atmosphere being,
At
the
the sea
typical
level. Yeah.
atmospheric pressure at sea level, correct? And then we'll go up to 1.3 for the first treatment, usually without oxygen, because we don't want to incur a high amount of oxidative stress in the first treatment. And then we'll go up to 1.5, then 1.75, and then 2.0, and then up to 2.2. We actually have the capability of going up to 2.4 now as well. So we'll usually use the highest pressures for sometimes for more neurological symptoms.
So, musculoskeletal symptoms would respond better to lower pressures, and neurological symptoms would respond better to higher pressures. Is that correct?
Typically, that's what we've been seeing.
Well, that's interesting. So in this 20 sessions, you would start lower at 1.3, and then eventually you would increase it to go to 2.2, and even now you're able to get patients to 2.4, and then you reassess to see if more sessions are required.
Correct. And we oftentimes have patients fill out a pre-HBOT survey of their symptoms and rate their symptoms, and they'll do that ongoing during the treatment.
Do you see Herx reactions with those undergoing? So Herx reactions is when the body just can't cope with all the detoxification and killing the infectious agent process that's going inside the body, and you might feel yucky. Let's put it this way, not well. Do you see these Herx reactions?
Right. So correct. So in your description of a Herxheimer reaction, we're getting basically toxins from the die-off of the bacteria, and probably an inflammatory immune response to the bacteria itself as well. So this is usually a good sign that we're on the right track with treatment, because that gives us an indication that the immune system is responding, that the body is reacting. This is usually a temporary reaction, usually for only sometimes a day, maybe up to several days, maybe up to a week. But since hyperbaric oxygen therapy is in and of itself its own therapy that has antimicrobial activity and also induces oxidative stress, we definitely do see an increase in these symptoms when it's initiated.
Decisions surrounding hyperbaric oxygen therapy can be complex. That's why here at Hyperbaric Living, we developed a special initiative, a free hyperbaric consultation, to see if hyperbarics can be a therapy of choice for you. I will answer your questions regarding hyperbarics, and you can book consultation at my website, www.drmasha.com. The link is in the podcast and video description below. And when you said you reassess after 20 sessions, but from your experience, how many sessions are typically needed? Well, I understand that one patient needs 20 sessions, another patient needs 120 sessions, but on average, let's say on average.
On average, we probably see the best adaptive effect and the best effective treatment with 40 treatments. So we're looking at 2 months of treatment.
Sometimes you go over 40, right? So some people receive
Yes.
more than 40.
What we find is that you can do 20 to 40 and then afterwards almost do maintenance, right? So you might not need to do it every day, but you could do it 1 to 2 times a week, because some of the responses that the body has to the hyperbaric oxygen therapy itself is an adaptive response. It's actually not unlike exercise, right? So if you start in an exercise program and you only exercise once a week for 8 weeks, probably not going to incur a huge amount of change in your body, right? But if you started exercising 5 days per week for 8 weeks, then you're going to see a physical change in the body. There's going to be adaptive responses. You may gain more strength, more muscle, better cardiovascular. Uh, and so you get to a particular level, and then after that it's almost like you can maintain it, right? And then if you exercise 1 or 2 days per week, you could almost sort of maintain that change that you incurred over that first 8 weeks of exercise. So we'll see a similar thing with the hyperbaric oxygen therapy. If you were to do it initially once a week for 8 weeks, probably not going to have that dramatic of an effect with it. But if you did it every day, what it's doing is it's adapting to the higher amounts of oxygen that it's receiving. And part of that adaptive response is creating more antioxidants to handle the oxidative stress that the oxygen is incurring. And so you actually gain an increase in antioxidants, and so that is part of the adaptive response. The other is stem cells, right? So we're actually increasing the body's ability to create stem cells, and this is going to happen with repeated doses of oxygen over that period of time.
And that will happen with continuous use of hyperbarics. That I think that's important. This
Correct.
is what I see from my experience and from clinical studies, that especially for the stem cells, you need continuous exposure. So doing one hyperbarics today and another session in 2 weeks, it's not going to do much to stem cells.
Correct.
Unfortunately, it's got to be 5 times a week, 4 times a week, or whatever is the protocol that your physician is recommending. So you've mentioned the mechanisms. You've said that first, or maybe not first, but you've mentioned it first, the antimicrobial effect of hyperbaric oxygen, then increased production of antioxidants, because it's a pro-oxidant therapy, right? So it puts your body into oxidative stress, and then your body starts to produce more endogenous, internally produced antioxidants. Are there more or other mechanisms that in hyperbaric oxygen therapy that you think are responsible for its positive effect for Lyme patients?
Yes. So what we see with an inflammatory condition, part of what the immune system does, so the immune system is designed to kill and attack, right? So and to attack these invaders, these foreign microorganisms. But its other mechanism is to repair the damage that has been done by these microorganisms, right?
And by actual attack, right? Because that immune system attack produces a lot of inflammation.
Correct, it does. So it's interesting because, like, if you were to hurt yourself, right? If you were to twist your ankle and then you have a swollen ankle, so that's your immune system trying to repair that damage to that tissue. So that's from trauma, right? What we get from infections is that we get a same level of trauma, but at a much smaller level, typically at a molecular and cellular level. right? And so if these cells are incurring damage, then that's when you get an immune response. That's why we get so sick when we get viral infections, because viruses, when they infect cells, they actually lyse those cells to infect new cells. And so that cellular lysis actually incurs a very strong immune response, because the immune system is sensing damage to cells, right? And then it's an afterthought that it actually finds the viruses to actually kill to target, kill the viruses, because it's sensing the damage, then it goes to the area and it finds out what's causing the damage. Lyme disease, because it's a bacterial organism, it actually does not need to infect cells to replicate. They can replicate on their own, and they can actually not replicate, or slow growing forms. And so that is the problem with the infection, right? So it can hide intracellularly, and the immune system might not actually be aware that it's even there, because it's not really incurring a lot of damage to that particular cell, right? And so that's what we see with these microorganisms, this immune response that is causing all this damage. And so oxygen, what does it do? It's healing, right? It heals the cellular structure, it heals the tissues. And what we see then is that the damage that is caused by the infections is actually getting repaired. So if you can kill the infection, or at least reduce it, while at the same time healing the cellular tissues and the structures with oxygen, then that's why we're getting this faster response to improve symptoms. Now, the body has a self ability to heal, and it can heal, and it will over time. But depending on the amount of damage that's incurred to the body, that amount of time could be a month, but it could be 6 months, it could be a year, right? So this is not unlike what we've seen with COVID infections over the past couple of years, right? That this is a viral infection that tends to cause a lot of inflammation. It affects people differently. For some people, it can be very severe. For others, it can be a very minor infection. And then for some, they can have sort of post-infection consequences, right? Brain fog, fatigue, chronic aches and pains and joint pain and so forth. So, and that is likely sort of a chronic inflammatory response that's happening after the infection.
Which hyperbarics helps to diminish.
It's helping to repair the damage that has been incurred by the inflammatory response. And then another mechanism, if we actually look a little bit further and deeper, is that when there is inflammation in the tissues, there is actually hypoxia that occurs. There is a lower level of oxygen in the tissues. And so when that happens, there's actually a protein called hypoxia-inducible factor, and it is sensitive to low levels of oxygen. And so when the oxygen levels get low, this hypoxia-inducible factor, or HIF, actually stimulates NF-kappa B, which is one of the major drivers of the inflammatory response. So in low oxygen levels, you actually incur more inflammation. And they actually did studies on this in high altitude climbers, because at high altitudes where there is lower amounts of oxygen, they actually incur a lot more inflammation, cerebral edema, pulmonary edema, due to lack of oxygen. And so that's why this actually has been investigated. So low oxygen levels actually does incur more inflammation. So when we actually utilize hyperbaric oxygen therapy and increase oxygen to that area, we basically reduce this HIF factor, and therefore we inhibit that inflammatory response, and it actually has a direct mechanism for decreasing inflammation.
Well, thank you for explaining this. I always I'm a nerd. I love, to dig deep inside and like know how is this happening, the physiology. And guys, by the
Hmm.
way, as part of Hyperbaric Living Podcast, as part of the initiative, we offer free consultations to see if hyperbaric oxygen therapy can be right for you. So the link to that free consultation is in the podcast or the video description. Please feel free to book a consultation. Thank you for explaining this, Dr. Korey. I have several more questions for you. And one is the pressure. We have people who only have soft chambers that go up to
Hmm.
1.3, and some of them have Lyme disease. What would you recommend? And maybe they don't have access, they don't have a clinic that offers higher pressure treatments, they need to travel. There could be many reasons. What would be your advice to these people? Is higher pressure absolutely a must, or can they get away with 1.3? Or like what is the what is your experience?
So, in our experience, a pressure above atmospheric pressure, sea level, is still going to be effective, because in how hyperbaric oxygen therapy works is it actually uses a couple of laws. One main law, Boyle's law, is that the pressure actually reduces the size of gases, right? And reduces it to the point where it sort of shrinks the oxygen bubble so that it can the oxygen can diffuse readily into your plasma, so into the liquid part of your blood, not the red blood cells, not the hemoglobin. And so this is an interesting concept because it's been very difficult sometimes to study hyperbaric oxygen therapy for conditions because they've had a hard time doing placebo, right? So you put
Yeah.
somebody in a hyperbaric oxygen chamber and sort of people can feel pressure,
Mhm.
right? So you can't really say that you can't put somebody in a chamber with no pressure because typically they won't feel it, maybe in the ears, they won't feel that pressure feeling. So what they do for what they call sort of sham HBOT is that they put them at the lowest pressure at 1.3, give them an oxygen mask, but actually don't give actual oxygen. They just regular room air, which room air is still 20% oxygenated. And then what they'll do is have the other cohort sort of do the actual treatments at higher pressures with oxygen. But what they always find is that the people in the placebo group and the sham group actually get better. Their symptoms improve,
Mhm.
right? And that's because the pressure, even at that lower pressure at 1.3, and just the 20% oxygen still drives more oxygen into the plasma and still drives a higher oxygen response. Now, it's not going to be higher than what you can get at 2.0 receiving greater than 90% oxygen, but it's still higher oxygen than what your body can get physiologically, and even what your body can get through the use of just oxygen, nasal cannula oxygen, right? For people who are, like COPD with low oxygen saturation, those types of treatments are only going to be effective for saturating hemoglobin and blood for people who have lung issues, right? Like emphysema and so forth. But the physiology of the pressure of a hyperbaric oxygen therapy, the pressure is what makes it important, because that's what actually causes the gases to actually diffuse into the plasma, and therefore from there, it's actually called Henry's law. It can go, the gases can go from higher amounts to lower amounts, right? So that's why it's going to diffuse into tissues. And so, basically we're using some of the the physiology, right? The science with the pressure to really deliver that oxygen to the tissues.
Thank you. Thank you for the explanation. So I think take-home message, if you only have access to 1.3, then use what you have access to and consult with the practitioner.
Correct.
I think that also needs to be stressed because you need to do things under the guidance. I wanted to say under supervision, but not necessarily under the guidance of a practitioner who knows what they're doing, who's experienced in treating Lyme disease, and who understands the possible outcomes and can help guide you. Are there any contraindications for patients who have Lyme to using hyperbaric oxygen?
There aren't many. Typical, the standard contraindications with hyperbaric oxygen therapy, certain types of lung issues, certainly like pneumothorax or blebs, certain types of potentially like ear infections or middle ear infections, that type of thing. Doing hyperbaric at that same time would probably not be advisable, but we have not seen for our Lyme patients, for the symptoms that are involved with Lyme disease, we really don't see a lot of contraindications at all.
Thank you for clarifying this.
Yeah, and older people, one of the issues might be sometimes cataracts of the lens. The lens actually is something that is avascular and so therefore does not have any antioxidant. So over time, that's actually why the lens gets cloudy and we develop cataracts. It's actually due to oxidative stress over many years. And so if you do many, typically it's probably over 100 hyperbaric oxygen treatments that actually can incur this cloudiness of the lens due to the higher the higher oxidative stress that we're incurring. And if you already have cataracts, sometimes that actually would increase that, right? So
But
that could be one contraindication.
Yeah, I wanted to add to that. That's only on really higher pressures above 2.2.
Correct.
And there's been studies that have been done in I think over 120 sessions. So I think if you're doing less than 100 or 120 sessions and at high pressure, then you maybe want to get that checked.
Correct.
But normally first at lower pressures and at lower number of sessions, we don't see that happening. It's in the literature, but it's good to know, and it's good to be proactive rather than reactive and get that checked. Dr. Korey, if people want to find you, where can they find you? Because as I said, many patients, and I have a big audience in US, so patients who are listening, or people who suspect they have Lyme or who already have the Lyme diagnosis, maybe they're in your area, in your state, how can they find you?
So the best access is going to be, of course, the internet, right? We all use the internet. So stramcenter.com. We have a great website that really is very descriptive and describes a lot of our therapies that we offer. We are multidisciplinary, so we have many different types of practitioners. I, of course, am a naturopathic doctor, but we also have a nurse practitioner, physician assistant, acupuncturist, licensed massage therapist, dietitian, Dr. Stram, who's a medical doctor. We have a team of nursing staff, and so we bring all these expertise together. And that's really what our patients get when they come to see us is the expertise of all of us. We do case reviews once a week, every week, with the full team of providers and nurses to really try to get our minds together on sometimes some of the toughest cases to really try to come up with the best solutions and the best treatments for them. And of course, oftentimes many minds is better than one mind, right?
Yeah,
and
one brain is good, but two brains is better.
And so forth, right? We also have 2 new naturopathic doctors. We are opening a new clinic in Burlington, Vermont, It is in process, and that should be open in June or July of this year. And Burlington is, of course, relatively close to Canada and Montreal. We are utilizing hyperbaric oxygen therapy in that office as well. We'll actually have a larger 2-person chamber and also a single mono chamber as well. And they are higher pressure chambers, so they will get up to 2.0. And really, we're looking to expand the type of medicine that we do, because we believe this multidisciplinary approach is really the medicine of the future, rather than this sort of single sort of medicine approach, going to different specialists, looking at sort of treating, sort of one organ system at a time, right? As you know, as we are naturopaths, we look at the whole body, right? And treat more with a more whole body approach, and look at all symptoms and really try to get that person back to overall health.
Yeah, I agree. I'm also a big believer in integrative medicine and integrating different modalities, different therapies to get the best possible outcome for the patient. So wanted to thank you
Mm-hmm.
from the bottom of my heart for all the work that you do over there across the ocean from me,
All
and
right.
all the care, and giving people hope. I think it's super important because psychology, it takes up a huge part in any disease and in any recovery, and having cases where people have recovered gives other people hope, because Lyme can
Mm-hmm.
be difficult. A lot of times, oftentimes, it's a difficult diagnosis. It's a chronic diagnosis. So there is a center that is treating Lyme disease with success, or patients with Lyme disease, because we don't treat a disease, we treat a patient. And
Mm-hmm.
it was a pleasure having you on the show. And guys, if you enjoyed the episode, please, and you think somebody can benefit from this information, please share it with your friend. Don't forget to subscribe to my podcast, to my YouTube channel, to receive new episodes every week. And I'll see you next week. And thank you, Dr. Korey.
All right. Thank you for having me.